something in relation to cough, something in relation to coryza, and something in relation to, I think, pain in the extremities, weakness of the back, and pain of the knees. So there were a lot of reviews, and there was a lot of persons telling me, yeah, it was nice, and do continue in relation to cough. Now see, when you are basically treating patients of cough, it becomes very difficult for us to understand which symptom to take and which symptom not to take. So my advice to you, everyone, one thing is that whenever you are taking a case of cough, give at least few minutes to the patient so that we can get symptoms more rather than routine symptoms of cough. So this is the one thing which I want to tell everybody, because when we start doing cough mathematics, it will keep going on and on and on, it will never stop. So good afternoon, Dr. Navjot, Dr. Firoz, Kamlesh, good afternoon. So I think last time we completed cough, and if you have any questions regarding to cough and symptoms of cough, you can always follow up. Today I'll discuss, yeah, Dr. Babal, welcome. Today I'll discuss, I have put a YouTube and Instagram regarding vertigo. There were a lot of cases of vertigo which I used to find it very difficult to prescribe. Maybe few years before, few years in my practice, because normally what we were told, that vertigo, the good remedy, the best remedy is cocculus and conium, and it used to work. But I think if you have seen my YouTube video or our Instagram short, if my assistants have put that, I had a very interesting case of vertigo which was for 1.5 years, which was getting better but not cured. But just adding one symptom, that vertigo because of bad news or vertigo hearing bad news, adding one or two symptoms, I prescribed calcarea cup, and that cured the case. Vertigo sometimes becomes very irritating and very difficult to cure. For example, I had a very interesting case of vertigo, and the patient used to come and tell me, whenever I have vertigo, I go home, take some ice, put it on a towel and put on my head, and I feel much better. Now this was a very, again a very vague symptom also, and a very interesting symptom also. Vertigo better by cold application. And I prescribed the patient a single dose of natramur 1 ml, that cured the case. In the same way, whenever the patient comes to us, I had a case where the patient used to come and tell me, sir, whenever I have vertigo, I just stop my vehicle wherever I am, I just take one cold drink, whatever cold drink or a beverage or a Pepsi or a cola, and I feel much better. And whenever he used to travel with his wife used to shout with, that he just wants to drink cold drinks and Pepsi and and thumbs up and go this. That's why he is making an excuse that he has vertigo, he is better by cold drinks. Is it possible that vertigo better by cold drinks? And when I repetized the case came to, I did this symptom and I gave the patient Kali carb, which cured the case. So this is a very, these are the symptoms where you find something very, something very unique in every case. So give some time to the patient, and then you can cure the most troublesome disease or troublesome symptom also in a patient. Likewise, I had discussed the case of vertigo where the patient came and told me that I have vertigo continuously 24/7. She was taking medicines for 6 months, allopathy medicines, no change. Continuous vertigo, and she came and told me, now also I am sitting in front of you, I have vertigo. I also gave few medicines, but without relief, and then I prescribed the patient pomegranate. That is, the name of the remedy is granatum, Granatum, and I prescribed the patient granatum 30 in repetition twice a day for 7 days, and the patient gradually started feeling better. In a course of 3 months, I repeated, I went to 200, then I gave 1 ml, and the patient is about 80% better in course of 3 months. So sometimes, some diseases which are very difficult to treat, very annoying and very irritable, you give some time to the patient and automatically you start getting results. So this is in relation to I want to discuss vertigo because of late I had really good results with vertigo. Now, if you coming back, yeah. So okay, my assistants are writing the name of the remedy also. So coming back to cough, if you have any doubt relation to cough, we discussed Rumex, we discussed Drosera. I think we discussed quite a few remedies in relation to cough, and we discussed quite a few remedies in relation to pain in the knees. Now again, pain in the knees is uh, again not easy, because normally whenever we have pain in the knees, more often than normal we prescribe Rustox, because most of the ladies have the symptom that when they are sitting, the pain is in, and getting up, they get pain in the knees. If we go forward with this concept, that the patient has pain in the lower back, the patient has symptom in relation to pain is better aggravation from first motion and better by rest. So one is Rustox and one is Bryonia. This is how the symptom pattern you have to take care, and automatically you will start getting results. Yeah, anxiety with vertigo. Now, Dalicum, and I think fourth is, which I have seen in my practice, is Causticum. You can give that also. But I would suggest you that add few symptoms more, because this symptom is very, very common in vertigo. You become normally anxious that what is happening, what is happening. I had a case where the patient used to say, sir, I have vertigo. Do I have brain tumor? Do I have brain tumor? So I prescribed the patient, opium, fear extravagance of. The only remedy is opium, but vertigo during anxiety also is opium. That's how you have to treat the case. Good afternoon, sir. Tooth sensation aggravates touch by normal water. Sensitive to normal water, can drink normal water, sir. Pain, yeah. So see, whenever you are treating a case of teeth pain, now most of the cases, teeth pain is basically aggravated by water. Whenever the water touches, the pain increases. So this symptom is not, I have seen in my practice, not so important, because this is a normal symptom which the patient suffers from. In your case, if it is not better with cold and it is very painful, make sure that the enamel of the teeth are proper. In that case, you can think about three remedies that comes to my mind. First is Bryonia, second is Pulsatilla, and third is Maccarum. You can also think about Ferrum Phos, in LM potency repetition. Okay. And whenever you find that the question is answered, do tell me that you have understood, so that I know that I have to go forward. Otherwise, I can again go back and give the same answer, and it depends on the symptom totality. So I hope the cough part is over. Make sure that in cough you give some time to the patient, because it will be very difficult to understand, because the patient will keep on telling dry cough, dry cough, dry cough, aggression lying down, better by sitting, aggression night, and there are 4-5 remedies that comes to your mind. Give some time, ask some unique symptoms, the patient will tell you, and observe the patient. How is the patient behaving during cough, or how is the patient behaving when he comes in your chamber? Okay, I hope you understand, everyone. So now vertigo, I think this was the case which I wanted to discuss in vertigo. If you have seen my YouTube videos, do see I have basically presenting something called as non-verbal communication. Now this is very important, because this symptom the patient does not create by his mind. The body is throwing symptoms. In fact, you can say the vital force wants to tell you that, see, I have this symptom, please try to treat me. For example, in relation to perspiration, I had put a video on perspiration. Do take that as a non-verbal communication. One patient came to me, that the patient says that, sir, I don't get perspiration too much, but whenever I close my eyes, I start perspiring. And I was not able to differentiate 3 or 4 remedies, but when I got this symptom, I prescribed the patient lachesis, and then that worked for my case. So perspiration is a form of vital force telling you that please give me medicine because I have this symptom. So whenever you are dealing with non-verbal communication, and if you get that symptom, make sure to use that symptom properly in your practice, because that is an involuntary symptom. That is the body trying to tell you. That is the language of the body. This is very, very important. Okay. So let us go for, yeah, conium is also there. A lot of remedies. I'm just discussing what cases I have seen in my practice. That's what I'm, for example, the patient comes and tells you, sir, that, whenever I eat a lot of food and junk food and all, I start getting nausea, and with nausea I perspire too much, and then I feel, whether I'm going to die, so I want to do my work very, very fast. I prescribe that patient single dose of petroleum. You can also think about Tavacum, and you can also think about Veratrum. So these are, yeah, even conium is there. There are a lot of remedies. If you open the repertory, there will be so many remedies. So I'm just discussing whatever cases I have treated and cured in my practice. That is what I'm discussing. In repertory, new repertories are coming, new additions are coming. So a single rubric has, maybe previously 10 years back were 2 remedies. Now we have 20 remedies. So in repertory there are a lot of remedies. So perspiration with nausea. Think about petroleum, Tavacum and Veratrum, which I have seen in my practice. In the repertory, you may have, a lot other remedies that you can go home and read. But this is what I have seen in my practice. For example, if I had an interesting case of anxiety, so much anxiety that the patient says, with anxiety, I have a lot of palpitation and a lot of perspiration. Patient, okay, I'll just take a question first. Patient having liver cancer along with ascites, lying calm in hospital. When asked any problem, says no, sodium potassium level low. This is a very, very interesting case, and again I would say that you have to be lucky, that you basically have these type of cases to treat. So do make best of best of the treatment give, because if you try, if you want to cure these type of cases, your entry point of the remedy has to be very, very important. So Navjot, if you have not given that a case any remedy, 3 remedies that comes to my mind that you must think about. First is hyoscyamus, second is Merksol, and third is pulsatilla. The rubrics which come to my mind, if this is only the case that the patient says he is well in spite he is very much sick. Okay, alcoholic liver cirrhosis. So the patient says that he is well even if he is sick, and he just wants to remain in bed. So bed desires to remain in. Hyoscyamus, Merksol, pulsatilla, you can think of these remedies. Of course, Epismel, Arnica and Argentum are also there. But in my opinion, if there were no symptoms apart from this, do think about hyoscyamus, Merksol and pulsatilla. One of the 3 remedies in LM in repetition. Just give that one globule poppycide in 100 ml water, 10 strokes, and then repeated doses, so that the patient comes out faster. Okay. Batch book for Blash flower. No, I very sporadically and sparingly use Blash flower remedies. So I would not be a judge in telling you which remedy, book you should read. At random, I have read Dr. Bag's book, and I'm not a very aggressive practitioner of Blash flower remedies. So okay, so I think do tell the results what happened, Navjot, because a very interesting case, and if you crack this case, you'll be very happy that you have done something in your life. This is very, very important, because otherwise routine practice we keep on doing it, but these type of cases gives you also satisfaction and gives homeopathy also good name. LM potency, yes. Fibroadenoma, both sides painless. Now again, a very, very common symptom of fibroadenoma today in this psychosyphilitic world. First of all, make sure that why the patient developed fibroadenoma. In today's world, there are a lot of girls, a lot of young ladies taking medicine to postpone their menses. Medicine because they don't want menses, because they have to go for work, they have to go for puja, they have to go for marriage and all. In those cases, when the patient has taken lot of hormonal pills to postpone the menses, in those cases also you have fibroadenoma. So in those type of cases, you may start the medicine with progesterone or estrogen, depending on the patient's personality. For example, if the patient comes and tells you that the fibroadenoma is very, very hard, it is like a rock, like a stone, think about calcarea floor. The patient says there is fibroadenoma and the pain is in relation to menses before and after it increases. Think about conium, think about phytoleka. Just a one note in relation to conium. I have got very good results when I have used conium in 3C potency. Okay. Then when the fibroadenoma is big and there's a deformity in the nipple, you can think about Asteria rubens and so on and so forth. If there is fibroadenoma and the pain is referred to the axilla, think about phytoleka. These are the remedies you must think about. But conium 3C, I have got very good results. Sir, kindly tell some medicine for extreme lethargy feeling throughout the day where a person does not want to do any activity but only wants to sleep, middle age. Yeah, you can go to the rubric, veriness, vary of life, very some, and then there are a lot of remedies: arsenic, aurum, phosphorus, natrum, sulfur, lycopodium, zinc, sulfur, staphylococcus, a lot of remedies. Again, the cause is very, very important. That you have to, that is the key. Now, phytoleka decantra, not berry. So let us go. Yeah, see, a lot of remedies are there, of course. Then you have to try to differentiate within the remedies. This is the basic remedies which we use in our practice, in day-to-day practice. That's why it is important to differentiate those remedies. That is more important. So, in fact, if phytoleka is such a remedy, when we were learning homeopathy, it was as good as everybody used to tell us that give the phytoleka, it will work. It was almost specific when we were taught, mater medica and this type of complaints. For example, if you go and read phytoleka from Allen's keynote, it was told to us so many times that it has printed in our mind. Breast show an early tendency to cake. It is full, stony, hard, and very painful. And especially when suppuration is inevitable. And when the child nurses, the pain from the nipples go all over the body. That is phytoleka. So it was such a symptom which is engraved in our mind. But when we matured and we had some lot of case fibroid, then we started to differentiate what remedy to give on. In fact, phytoleka has a very interesting symptom. The nipples are very sensitive. They are sore. They are fissured. And the pain radiates from there all over the body like graphitis. So this is how you differentiate, and then you can prescribe. Okay. Sir, kindly also show some medicine for extreme piles, extreme pain. Yeah, you can think about a lot of. Thank you, Navjot. That's very nice, and keep growing in life and keep giving good results. That's very important. And Nitin sir, kindly external piles, we have done piles so many times. You can go to the YouTube video and just check my piles. There are so many new piles. See, basically we have basic remedies for pile like Hamimelis or Esculus or Peonia, Ratania, sulfur, nitric acid, calcarea floor, lot of remedies. I always tell you, the defining symptom of the disease is very, very important. Otherwise, what will happen that you prescribe on specifics and then you say that homeo does not work. So don't go for specific. Symptom is very, very important. Okay. Painless fibroadenoma. Yeah, this is a very, very very, very interesting symptom. Sometimes the patient comes to us and the lump is absolutely painless. So just go and examine the lump. If the lump is very, very hard, think about calcarea floor. If the lump is hard, not so hard like calcarea floor, and the borders are uneven, think about lapis alba. Examine the lump. If the lump is present in the median, there are 4 quadrants of the breast, in the median side, lower quadrant, then you can think about phytoleka. If the pain is in the outer quadrant, also it's phytoleka, decantra. If there is lump and there is no symptom around the nipples and there is a history of cancer in the family, think about carcinosin, think about schirinum, also think about Huangnang. If the lump is just a lump on the upper side, on the medial side quadrant, think about phosphorus and China. If it is on the lower side, outer side, think about Nux vomica, think about Strychninium phos, and think about Physostigma. So depending on the quadrants also you can prescribe the remedies, but then you have to have some symptom to prescribe, because if you prescribe by blindly just calcarea 4, it may work or it may not work also. This is my advice to you. Yeah, so let us go forward. These are very common medicines, calcarea 4, this is very common. So let us go forward. I hope this part is done, everyone. This part is done, the fibroadenoma, the cough part, the vertigo part, the modalities part, so that we can go forward. Yeah, right. Fibroadenoma bleeding from the nipples becomes a very important symptom, doctor. Then you have to just diagnose that it is whether it is carcinoma in situ, then whether it is mastitis, whether it is a cyst, or whether it is a duct papilloma. But whenever there is bleeding, there has to be inflammation, there is pain. In simple remedy, then you have to think about is belladonna. It would work wonderfully. I had cases, in fact, just now about last week only I had a case where we treated that case and the patient is much better. The noodle is better. But depending on the age, the patient's age is 20, 30, 40, 50. Depending on that, if there is bleeding from the nipples, the diagnosis changes, So it's very important to diagnose, because if it is related to hormones, because of progesterone, because of estrogen, then you have to think about some intercurrent remedies like progesterone and estrogen. So make sure that the age of the patient becomes also very important in this case. Okay. I hope you understood. Bleeding, because if it is bleeding, then it becomes very important to diagnose, and then it see whenever there is bleeding and if we are suspecting cancer, then there are a lot of remedies, depends on how is the bleeding. If the bleeding is okay and it's slight, blackish tinge, so you think of creosote. Normal blood, you can think of phosphorus. Maroon blood, maroonish type of blood, you can think of lachesis. And cancer mummy, you can think about thuja. Bright red blood also, you can think about belladonna. In fact, I had a case where the bleeding was there, it was dark and with thick clots. That was elapse. Sometimes bleeding is there, but it is like serum coming out, very sticky and thick bleeding. Then you can think about plumbum metallicum also. So that is also very important. I hope you are understanding. Doctor, who has asked me? Dr. Vikas, I hope. Yeah, so bleeding, I think my assistant was asking me the question. So I hope the bleeding part is taken care of. If there is bleeding nipple, make sure that you send the patient for diagnosis, because otherwise the patient comes and tells you, sir, doctor, why did you tell me I had cancer, I had this, why don't you examine the case? Though we don't need the diagnosis, but for us safety it is important to understand what we are treating. So think about phosphorus, creosote, lachesis, plumbum, elapse, thuja. These are very remedy with syphilitic miasm and the bleeding from the nipple. That is very important. I hope you understood. Chocolate cyst, right nipples, I would basically go for case taking, doctor. In this, case taking is very important. Yeah, bleeding is, though bleeding is occasional, but it is a syphilitic symptom. No, the body's vital fluid is coming. It is a syphilitic symptom, so it can never be taken lightly. That's why bleeding is there. Make sure that you give that symptom importance. That is very important. I hope you understand, everyone. Which symptom to give importance in case taking is so important. See, normally a good case taking is half the work done, Dr. Kent has said. But which symptom to take and give priority, that is depending on the miasm. Yeah, movable, basically, Dr. we have just tell all over the body. We have told Dr. Vikas that you can always go home and again see this, YouTube live. I've given you most of the remedies. You can go and get the remedy from here also. Yes, Dr. Kamlesh, it's okay. So I hope this part is taken care of. Bleeding from the this is a very important and interesting topic, because in allopathy as such there is no specific medicine. They give, I think, vitamin E tablets, and if it does not work, then basically they go for operation, remove of the lump, and most of the time the lump comes back, and when it comes back with more pain, more bleeding, and the size also increases. So in homeopathy we can definitely treat it, and we can definitely give good results in most of the cases. Okay, so I hope everything is okay. Hello, all answers, all question answers. Let us go forward. Yes, So I will take some other questions. 1-2 questions have scrolled up, so I cannot tell the, I don't see those questions. You can again write those questions. So let us go forward. So I was just telling you something in relation to cough, So there were a lot of questions on my WhatsApp and my Facebook also in relation to cough. See, cough, I just tell you one thing, that don't always go on one thing, barking cough, Drosera spongia. There are, in fact, if you go and see the repertory barking cough, which we never think about, Hipparsulf also has barking cough. But normally we see Hipparsulf, what, that pain in the throat, actually thirstless. The patient takes hand out from the blanket and he has cough and Hipparsulf. Hipparsulf is also in barking cough with Drosera and spongia. Belladonna also is in barking cough with Drosera and spongia. In fact, if I am not wrong, Stramonium is also there in barking cough with Drosera and spongia. So don't always think about Drosera and spongia. I hope you are getting my point. Okay. Sometimes the cough is very loud. Any medicines for varicose vein? How long to give medicine and which medicine to give? See, varicose vein, most important thing, if the patient is in a habit of standing, tell the patient to use that compression socks, that stockings. The first thing, very, very important. Tell the patient that whenever he sits, make sure that the leg is kept straight, because if it's kept hanging down, it will come. And third, then you can start giving medicines. Depend on what stage the patient has come to you. If the patient has varicose vein and this ulceration and there is bleeding and all, the remedy would change. We have a very interesting remedy, that lot of doctors first give that, they fail and then start other remedies. For example, pain in the limbs while hanging down, and the remedy is Vipera. Now in varicose vein, because the blood is accumulated in the veins, the patient hangs his limb and the pain starts. So this sometimes becomes a normal symptom for varicose vein. In varicose vein, there are some common remedies which would definitely give you some results. For example, Hamimalis, for example, Vipera, for example, Valeriana, for example, Lachesis, for example, Sulfur. These remedies you have to give in LM potency. This is my opinion that I have seen in my practice. If LM potency repetition is required, that works better and that gives better results. Okay. And I have done this varicose vein in my, I think, YouTube live, 2 or 3 YouTube lives before. You can go and check my YouTube live. I remember that I had one case where the varicose vein was like whipcord, ghodi ki chabuk, that hunter of the horse, whipcord like, and the remedy was Hamimalis. Sir, early medicines for side effects for allopathy and psychiatric drugs. These are the questions which have been asked so many times, but my opinion is your similimum is basically the antidote and the curative medicines for allopathy, psychiatric drugs or any other medicines. Hello, are you with me? Early 3-4 morning breathless, 3-4 morning aggravation, Kalika, Pelvis, no response. Surprising, surprising. So don't go for the timing. 3 or 4. You can just write early morning. Early morning, if you go early morning, you have lot of remedies, because you have already failed with Kali. See, early morning you can think about Kali nitricum also. If Kali carb fails, I have seen very good results with Kali nitricum, and just before 3 or 4 am, Kali ars. So if you have failed, you can always try these remedies, but my sincere advice would be just take early morning aggravation, or you can say the type of cough and the type of expectoration, that is important. Okay. So the similimum is the curative, yes. So baby 2 months old in hospital, not able to suck milk, only fed through pipe. What will be the reason? Yeah, see, there is sometimes problem of musculation, the sucking process. It is not a problem. Sometimes in some child it develops late, the sucking process. So the child is not able to suck the milk from the nipples. In this case, you can give some remedies depending on the rubric milestones development late. Then you can prescribe the remedy. Okay. I think it is already half an hour up. Few questions, please do write me on the next YouTube so that I can answer that. So thank you everyone. Thank you for joining, and I hope you enjoy as much as I enjoy sharing my knowledge with you. Thank you so much. Until next Saturday. Goodbye.